Hi and welcome to the Mediverse. A lots of people find it very difficult to differentiate the disease symptoms and get confused. So, I have decided to help people to know the exact problem by investigating their symptoms better. So, I'll be starting a series in which I'll try to explain and simplify disease symptoms to help you guys better understand your health status. So, this time I'll starting this new series with a very common topic of headache versus migraine. Everyone gets headache from time to time, but if you are someone who is prone to bad headaches, you might find yourself wondering whether yours could actually be a migraine. It can sometimes be difficult to tell the difference between a migraine and a headache when you are experiencing such a high level of pain and pressure in your head. According to the research, migraines impact over 37 million men, women, and children in the United States. But fewer than 5% of those affected have been accurately diagnosed and receive appropriate care. So, knowing the key differences between headaches and migraine might be helpful. First, I'll be talking about the headache. Headaches are among the most common type of pain that people experience. There are over 150 different types of headaches, but they can be divided into two broad categories: primary headache disorder and secondary headache disorder. In primary headache disorder, headaches occur in absence of any other illness or disease. Migraine and cluster headaches are the two most common of this type. And in secondary headache disorders, headaches are actually symptoms of other conditions such as cold, influenza, tumors, head injuries, and a range of other diseases. There are many different types of headaches, so identifying the location and nature of your pain can be very helpful. So, some of the most common types include: number 1, tension headaches. In tension headache, the pain tends to spread across the both sides of the head, often starting at the back and creeping forward. This is the most common form of headache pain. Eye strain, stress, and hunger are frequently causes of tension headaches, and they can be chronic. Number 2, sinus headaches. These headaches often strike when you are sick or feeling congested. They are caused by swelling in the sinus passages, resulting in pain behind the cheeks, nose, and eyes. The pain is worst when you wake up in the morning and when you bend forward. Number 3, cluster headaches. These headaches are usually very painful and occur in clusters, which means they happen daily and sometimes up to several times per day for months. They are a result of dilation in the blood vessels of the brain due to a release of serotonin and histamines. They can be caused by physical exertion, bright lights, or even altitude. Now talk about the migraine. When most people hear the term migraine, they often think of a severe headache. But headaches are only one symptom of migraine, and they can range in severity and length. According to the experts, migraines are a neurological disease that involve nerve paths and chemicals. The changes in brain activity affect blood in the brain and surrounding tissues, causing a range of symptoms. In addition to severe head pain, migraine sufferer may experience some or all of the following symptoms. These include nausea, increased sensitivity to the light, sound, or smells, dizziness, and extreme fatigue. A migraine episode may occur in 4 different phases, though not everyone experiences every phase. The phase include prodrome phase, sometimes called the pre-headache phase. This stage features painless symptoms that occur hours or days before the migraine arrives. These include mood swings, food craving, and stiffness to the neck. Aura phase. Auras refers to the sensory disturbance that occur before or during a migraine. Auras can affect a person's vision, touch, or speech, though not everyone who suffers from migraine experiences auras. Examples of auras include blurred vision, blind spots that expand over time, numbness in the arm, and slurred or jumbled speech. Headache phase. This is when the pain usually hits, and it may range from mild to intense. Physical activity and exposure to light, sound, and smell may worsen the pain. However, some people can have a migraine without developing a headache. Postdromal phase. The final phase is when the pain has subsided. People may feel exhausted, confused, or generally unwell during this phase. If I talk about the pain location, migraines and headache can also have different areas where the pain is centralized. If you have a headache, you will likely feel pain and pressure in the forehead and scalp, and sometimes even toward the area where the spine and skull are connected. But if you have a migraine, you will likely feel pain on only one side of your head. You may occasionally feel pain on the both sides of the head when you have a migraine, but the pain will likely feel more intense on one side. If you can clearly identify that the pain is on one side of your head instead of across your forehead or across your entire head, you are likely dealing with a migraine. Each case is different though, so make sure you monitor for other symptoms as well. There are some key characteristics of migraines. First, migraine can disrupt your everyday life. If you have a headache, you can take ibuprofen or another form of pain relief medication and continue on with your day. You may feel discomfort in your head, but you can manage to do your daily tasks. But if you are experiencing a migraine, there is a slim chance you can do your daily tasks. Migraine can be debilitating. The more severe symptoms like light sensitivity and nausea may cause you to stay in bed for a couple of days. Number 2, migraines can have a distinct pattern. A typical headache just comes and goes, but a migraine generally goes through 4 phases. In the beginning, you will likely experience nausea, light sensitivity, fatigue, and muscle stiffness. These symptoms may be followed by a temporary vision loss, or you may see spots. Numbness and tinglings are possible as well. In the next phase, you can expect throbbing pain on one side of your head, vomiting, light sensitivity, and neck pain. During the final phase, before your migraine ends, you may feel foggy and irritable. Number 3, migraines can happen consistently. Some people who get migraines get them once or twice a month, whereas more chronic migraine patients can experience 10 to 15 migraines a month. It can be tough to determine what's the normal frequency of headaches and migraines. So if you are experiencing more headaches or migraines than usual, contact your doctor to discuss what's happening and whether you need to seek out a specialist. Number 4, migraines can have certain triggers. A typical headache can have various triggers, including head injuries, diet, and a lack of sleep. It all depends on how your body reacts to these changes. Migraines, on the other hand, can more easily be traced back to certain triggers. These include hormonal changes, stress, allergies, and a lack of sleep. It's also worth noting that if someone in your family suffers more migraines, you may be more likely to experience them as well. Number 5, migraines can last 4 to 72 hours. Migraines, however, tend to last between 4 and 72 hours if left untreated. The duration may vary from person to person, but that's what's considered the usual timeline of migraines. If you have a migraine that lasts longer than 72 hours or you have a prolonged headache, you should contact your doctor immediately. If I talk about the causes of migraine, you may find that certain factors trigger their onset. Triggers vary from person to person and can include gender and hormonal shifts. Women are 3 times more likely to suffer from migraines than men. Menstrual cycles and changes in hormones are a factor in migraines in women. Allergies, also called allergic rhinitis. Allergies cause irritation and inflammation in the body. Because migraines are associated with inflammation of the blood vessels, allergies are a known trigger for some people. Family history and genetics. People with family members suffering from migraines are more likely to develop migraines themselves. Genetics also appear to play a role in person's likelihood of experiencing migraine, as roughly 90% of the people with migraine have a family history of the condition. Environmental. This category includes a wide range of triggers like changes in weather, stress, food, smells, and lack of sleep. I hope this video will help you to better differentiate headache and migraine and enable you to know your health status. Please subscribe this channel as it will give me an encouragement to make better content for you. Thanks for watching.